welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. It's great to see you all. And if you're new to us, we're really excited to have you here because we're having some incredible conversations with some really sharp leaders within our space that are painstakingly shaping the future of healthcare. And we're really passionate around healthcare innovation, adoption, access, and leadership. And if it's your first time tuning in, let me just sort of tell you a little bit what we're trying to do here. So the aim of these conversations is around bringing real stories of innovation to life, people that are actually doing stuff, actually getting things done within our space and giving folks the platform to be able to share their stories with our community and ultimately with the world. And since our field is fast evolving, it's crucial to have leaders that can envision the future, eagerly embrace innovation, and address these pressing challenges. And we've got an extraordinary opportunity today. We've got one of those leaders that's on the line, Zach Rosen, the co-founder and CEO of Brellium. With a vision rooted in enhancing clinical outcomes and financial accountability through technology, Zach has steered Brellium to the forefront of healthcare innovation. And by integrating AI, which we'll talk about in a moment, into the workflow, Brellium has revolutionized how clinics ensure the quality of patient visits meets both clinical and payer standards all in real time. So this shift streamlines operations and significantly boosts the accuracy of patient care, documentation, and Zach's fully committed to this, and his team's fully committed to this. So we're going to learn a little bit more about their journey today. I'm super excited to dive into it. So Zach, it's great to see you. Welcome to the show.
Good to see you too. Thanks for having me.
Yeah, man. So what was the sort of personal professional drive behind founding Brellium? How does your vision for healthcare innovation sort of propel the company forward?
Yeah, absolutely. So most of us have pretty technical backgrounds on our end. Most of our founding team either had backgrounds in product or AI/ML prior. So it's kind of a pretty natural starting point on the technical end for us. On kind of why this exact problem and how we got individually started here, was more kind of on the personal end from my experience a few years ago. When I had a medical misdiagnosis issue that spiraled into 24 months of not so fun. And at the very end, we figured out that it essentially all could have been avoided upfront if a couple of individual compliance checkboxes were checked. So when our team started initially building what blossomed
Wow.
into Brellium, is we were focused on just that, which was analyzing medical documentation with technology to ensure that providers were first and foremost taking care of their patients correctly. And then also as an additional benefit is making sure that that documentation was billable. And that's kind of taken us to what's Brellium's become today.
Wow. So as you were going through that challenge, how long did it take before they figured out that there was a missed diagnosis? How long was that period?
The very end. So that individual experience was basically that a set of tests were supposed to be done upfront that were somewhat routine,
Mhm.
that just weren't. And then all of the following provider visits were under the assumption that those tests were run. And not till the very end, 6 or 7 different providers down the line, did we understand that those individual, somewhat routine tests should have been done, were done, and then we realized that the problem wasn't what initially was expected. So incredibly frustrating, not a fun experience, but at the end of the day, it's been a large part of what we've been able to do here at Brellium. So some good did come of it, but wouldn't wish that upon anyone else.
Yeah, so when you think about that problem and you magnify it and then you scale it, how is Brellium attacking that today? Talk a little bit about how from initial inception to where you are now, how has it evolved? Has it moved kind of far away from that, or is still the main crux, the main common denominator of what you're doing still around that?
The main crux is still largely the same, which is ensuring that patients are being taken care of correctly. Historically, clinical quality has been more or less a gut feeling for a lot of provider groups, not as out of malice, but more so just out of a lack of technology. Let's look at where we spend a lot of our time, which is in autism and in behavioral health, is if we're looking at those documentation kind of points, is that you're looking at a large essay, which is essentially just super messy, unstructured text. And so historically, technology just hasn't been able to accurately process that text at scale, which means that clinical quality teams have had a really hard time first measuring quality and outcomes. And then, as you know, if you can't measure something, it's hard to improve it because you
Yeah.
kind of the ball's always moving. So our focus initially and still largely today is how can we first and foremost help clinical quality teams measure what's going on day to day. And then number two is what data points can we help surface that helps folks improve over time. And that's helping individual providers better understand how to take care of their patients. And number two, and where we're headed, is helping those providers actually more accurately diagnose and improve end outcomes of those individual patients.
Super interesting. So as much as people want to talk about how healthcare is innovative, healthcare providers are notoriously slow to adopt new technologies. What what strategies has Brellium employed to be able to sort of facilitate the integration and the acceptance of your AI tools, into existing workflows?
Yeah, you're totally correct. Is that for any kind of new technology platform, especially something as cool, innovative, but also crazy and scary as AI, that it's hard to get folks to fully understand that, hey, this actually works. And so the way that we've kind of most had success is not by telling, but by showing folks. So with the vast majority of our customers, our pitch sounds pretty good, which is this kind of magically fixed quality function that's historically been
Yeah.
pretty messy. But we get the question all the time, which is, this sounds great, but how do I know this works? And the way that we do it is that we let folks upload their own documentation to Brellium with their own custom requirements, and then they can see our exact results to determine, hey, how exactly does this match how our existing process works? Is this better, worse, or kind of right on the money? And then they can individually make tweaks that they see with their own eyes. So they know that, okay, this works for us before they kind of end up moving forward, which has been a huge unlock with us in building trust that basically, hey, this isn't a magical pipe dream. This is real and it works to help improve your business.
How were they doing it beforehand? Was this very human capital intensive? Basically, hey, you need to do more of this, so let's hire more people to do this. What were you up against? What's the incumbent that you're up against? What is good enough in terms of the existing state?
It's generally humans. In some kind of more edge cases, it'll be nobody. It really depends on the business. Usually we've seen businesses that have run into more tangible quality issues will generally have built up a more robust compliance program, usually by staffing a bunch of full-time employees to solve this
Mhm.
problem. But for small to mid-sized folks that historically haven't run into compliance issues, quite frequently the first time that they look towards either building out a team or a solution like Brellium is when they run into a large scale, either clinical quality or kind of a payer clawback issue. So usually that's the kind of hair on fire moment where they're like, okay, hey, we actually need to fix this problem that we,
Yeah.
in most cases, didn't know existed before. So when we go to our customers, generally kind of the end ROI discussion is, look, we have individuals in your business that right now spend a lot of time going through documentation. We can instead have their time just focus on reviewing the results of that already analyzed documentation. And generally, these are in-depth, ingrained knowledge workers in the business that have really in-depth understanding of how operations work, how clinical works, how different
Right.
politics within the business work. So usually those folks can actually be better used elsewhere within these fast-growing businesses, which has been awesome to see them focus more on knowledge as opposed to kind of day-to-day more nitty-gritty. And that's for folks that kind of already have manual built out team. For the folks that don't, it's, hey, you guys can plug in a solution with technology that scales with you as your business grows. And you know exactly what's going well and what's not. And for the stuff that's not going well, exactly how to fix it, which is usually a pretty good value prop for them.
Yeah, it is really good. I like it how you also are meeting them where they're at and you're saying, hey, we can demonstrate value before you commit. Oftentimes it's commit, then let us show value. What was the thinking behind that to say, let's kind of do the try before you buy? Was there any methodology behind that hypothesis that you guys had put forward? Because clearly it's working.
Yeah, well, I mean, I've been a founder and a business owner a few times, and myself, like yourself, and kind of other kind of business owners, is we bought a million different products that the sales pitch was awesome, And then you actually kind of get in the driver's seat and you realized, what am I doing here? How does this thing actually work? Is this actually helping
Yeah.
me? So for us, it was more like we had multiple experiences where we bought products that didn't quite work as advertised. It seemed logical that if we showed folks instead of telling them that this thing actually worked, that it would make them feel more comfortable, enable them to move forward quicker and get their teams on board. And so it was initial gut feeling. That gut feeling ended up proving correct, and that's been a kind of a large part of our sales model historically.
And then you also mentioned that you guys have a beachhead in the autism and the ABA space. Was that by design, or how did you come to that?
No, it wasn't by design. So the initial product was largely geared towards outpatient behavioral health, so predominantly psychotherapy. We started getting folks kind of in the ABA world reach out to us en masse. The reason is largely the scale of documentation. So let's use a therapist, for example, in outpatient behavioral health. Normally they'll see a patient, let's say 1 time a week for an hour, and that means one session up per week. When it comes to ABA, a huge portion of our ABA customers are seeing most of their clients for 30 hours every week. So that means dozens upon dozens of session notes for each of their clients. So with the scale of the documentation present, it's really hard to have human beings or kind of anyone take a look at documentation without technology, just because there's so much of it. So that was kind of one of the big inflection points of the business was when we started serving some of our ABA customers. Initially, we started off with some of the larger agencies in the country, and some of the other kind of mid-sized agencies also end up coming to us after the initial proof of concepts were built. And that's kind of taken us today, where we have dozens upon dozens of some of the largest ABA businesses in the country on board as happy customers.
That's brilliant. And then how do you see AI, machine learning sort of shaping the future of patient care documentation? And then how do you see Brellium being at the forefront of this transformation?
A hard question to answer. That's really tough. I think that even for someone in my shoes, and I do this every day, that it's really hard to see how folks shape up, even kind of 6 to 12 months from now.
Yeah.
But so high level, how we think about it is that right now, there's a ton of unstructured documentation that historically hasn't been able to be processed just because of the volume and that computers essentially weren't good at it yet. So the vast majority of the time, it just was left untouched. So I think that the lowest hanging fruit when it comes to how technology has evolved and how that can help healthcare in the short term, so I define that as between the next 12 to 36 months,
Mhm.
is structuring that previously unstructured, unintelligible documentation. The next step is more kind of on the structured ML side, is what we do with that now structured information. And so that largely, I think, will come down to improving diagnoses and improving end patient outcomes. But as mentioned, everything here is changing in 3 to 6 month increments. So I'm sure that 3 to 6 months from now, I'm going to have a very different opinion on how things will shape up soon.
Yeah, I asked that just because your background is super interesting, sort of being a computer science sort of focus, but also having spent and done a tour of duty in finance. I'm just wondering how have these disciplines in your previous tours of duty, how have they influenced your approach to healthcare innovation, to the things that you're doing within Brellium?
Yeah, I'd say most of the influence has been on the computer science side of the house. I mean, historically, healthcare is notoriously tough to adopt new technology. So I think that when you come to healthcare with a deeply technical team that understands how to solve really nasty engineering problems, I think that naturally you have a bit of a leg up. On the finance side for me, to be honest, not kind of too much of a learning experience there. I think I learned how to work hard late into the night, which is definitely helpful. But most of kind of our learnings here have been on the computer science side. And then just over time with previous businesses, learning more kind of what enterprise customers expect, how they expect to be treated, how they expect implementation to go. I think that's largely been kind of what's dictated how the business has gone over the last few years.
And would you mind maybe even just sharing a success story that highlights the impact that Brellium has had, on a clinic's, operational efficiency and quality?
Yes. So there are two of them. So one is more kind of hard numbers wise, and it was with one of our early customers, Cerebral Mental Health. An
Yeah.
article was actually just released on this a couple of weeks ago. And the
And
hard
we'll put
numbers,
the link in the description also so people can get access to that so we can maybe get a little bit more traction on it too.
awesome, cool. But so the hard numbers there, and what we were most excited about was that across their entire base of clinicians, that they've seen an 8% increase in meeting all of their clinical requirements just over the last 6 months, meaning that essentially the entire business has improved their clinical quality 8% in half a year. Which from an end patient standpoint is awesome because again, it's only been 6 months. And seeing how that compounds over time as providers get better feedback on what to do and what not to do, is kind of awesome to see that trajectory blossom. Number two, and this is probably my favorite one from kind of a customer success story, was one of our early customers. Her name's Ariel. She's an awesome human being. She ran billing and quality for her ABA business.
Mm-hmm.
She spent about 60% of her working days just going through audit by audit by audit, and wasn't having a super great time in it. Once
60%?
60%, yeah.
Wow.
And so when we came in, that 60% of her week was instantly freed up to the point where she was actually able to spin up a business on the side through Etsy that ended up going super well to the point where she was able to bring in her replacement, train her replacement, and is now a few months later gone full time on the business that's taken off. And she's
Wow.
kind of in a whole new world. So I mean, obviously I'm a bit biased here given that I'm a business owner too, but to me that's just an awesome experience that we were able to kind of have someone unlock their kind of career, life, etc., as a byproduct of using a clinical auditing product, which was awesome to see.
That's really neat because I think as and I was actually just talking about this with someone is this, how do you measure the success beyond the financials, right? Beyond the financials. And that's probably a prime example of what you can do, which is to unlock and to untether someone from that time to be able to maybe uniquely focus on another area that could add even more meaningful full impact. Kind of flipping it onto Brellium's side, particularly in terms of outside of the financials, how do you measure the company's success beyond the financials, whether it's in terms of societal impact and even on helping health outcomes?
Yeah. Well, so high level is that healthcare services businesses are notoriously low margin. And so any dollar that is reallocated from something like auditing can naturally go elsewhere into the business. And that's either growing their footprint so they can serve more patients, more dollars into improving quality of care, into improving facilities, etc. So kind of more kind of from the tangible standpoint, it's there. It's basically resource allocation. Number two, and this is kind of getting a bit into the products that we're rolling out over the next couple of months here, is actually more tangibly helping with patient outcomes and patient diagnoses. So I don't want to give too much away, but as mentioned kind of earlier in the conversation, we think that now structuring historically unstructured and messy information is really powerful in most industries, but specifically in healthcare. And we're really excited to roll out some additional new modules that are going to help our customers better improve patient outcomes. That I'm pretty excited about personally.
It just seems as though that you're very, very focused on the customer, the life cycle of the customer, meeting them where they're at and guiding them, sort of being that Sherpa per se. I want to switch gears a little bit because we talked to a number of emerging company founders, and there's just running a startup, running a company is notoriously challenging, especially when there's a lot of uncertainty surrounding that. Can you share maybe a moment of doubt that you kind of had to move past, what it was like to maintain that resilience in the face of adversity? Anything that you can share to other fellow founders and entrepreneurs that are tuning in right now?
Oh boy, they're 1.5 million. So I honestly I wouldn't even know where to start. What I would say is kind of first off is like take a step back. Like what are you trying to do when you're building a new business? especially something with innovative technology, is you're trying to kind of push something into the world that historically has never existed. And usually, given that markets are close to perfectly efficient, there's a reason why what you're trying to do has not existed before. So naturally, that is very hard because there are existing folks that have incentives at play. There are new customers that you have to convince that your new solution is going to change their lives. And all those things compound on top of each other. So it's naturally hugely, hugely, hugely difficult. So it's natural for doubt to creep in. We've had a million experiences of where the company nearly died a few times. A few years ago now, we were pretty convinced that our business itself wasn't going to work. And so we went back to our existing investors who've been amazingly supportive and essentially said, hey guys, we don't think this is going to work, but we're going to keep pushing for a few more months to try a few new things. And if things work, awesome, we'll be off to the races. If things don't, then we're going to wind things down and call it a day. And at this time, our company size had shrunk dramatically. It was just a few of us in a room, just kind of grinding for each other to try to kind of put something into the world and make it happen. And by a mix of, luck and timing coming together and also kind of working our butts off, we were able to kind of push something into the world that ended up working. But there were many, many, many weeks and months in that time period where we were pretty convinced that we were about to go back to everyone and say, hey guys, we did our best, but it didn't work out, which was unfortunate. The tangible piece of advice that I'd have there is kind of just keep swimming. My philosophy is that if you keep pushing things into the world, most of them aren't going to work, but eventually one might, and all you need is the one to work. And it's a kind of a powerful concept to just keep going.
Right on. And because you're really close in collaborating with providers and ensuring the quality is there, I'm just wondering, what's the collaboration like with insurers? And if we're trying to sort of create a more integrated healthcare experience, can you maybe even comment around that?
Yeah, so I think that general school of thought is that providers and payers are kind of at odds, financial, incentives wise, et
Right.
cetera, and each is doing everything possible to one up the other. Um, I think that when you actually speak to both individual groups of people and specifically the folks that are responsible for making decisions on both ends, I think that that myth gets dispelled pretty quickly. Whereas in general, folks are kind of open to working with each other and have the same end goal, which is make sure that patients across the country are taken care of correctly and then grow their businesses, and are open to working more collaboratively than kind of the general sentiment is now. When it comes to where we play in our individual business, I think that we're one of the few places in healthcare where provider and payer incentives are actually close to completely aligned. In that this clinical quality piece has not been solved on either end and is kind of universally really inaccurate, messy, expensive, and results in a ton of ambiguity. Just by nature of if you and I both looked at a document with a list of requirements, I think both you and I would come up with completely different reasons of what's
Right.
good and what's bad, just because different backgrounds. I think similar situation here. So how we see it is that if we can build a bridge between the two, it saves hassle, time, money at the end of the day, results in better clinical outcomes on both ends for both payer and provider, which is a pretty awesome kind of end state for both parties of folks.
Fascinating how you talk about how there's more common ground between payers and providers on the topic of quality, and that is definitely true. So it's easy for us to look where there isn't common ground and then kind of poke and say, oh, he just said this or he said that. Rather, you're taking the approach of, okay, we quality is important to both a provider and to a payer. So how do we build on that? Which is definitely a really interesting framework, perspective to start from. So give us maybe a little bit of a commercial about Brellium. How can those that want to learn more, want to follow your story, tell us a little bit about Brellium and where we can kind of learn more about the work that you guys are doing.
Yeah, absolutely. So I know that we've covered it a bit today, so I won't go too much into us, but the tagline on us is that we help clinics automate their chart review with AI to make sure that one, their patients are being taken care of correctly, and then number two is that their documentation is billable according to their payers' requirements. You can find us at www.brellium.com.
Awesome. And then the last question is always is, for our community, it's about doing, it's about taking action. So if there is an action item that you would sort of say for someone to take action on from this conversation, what's that one golden nugget that you would encourage someone to take action on?
Oh boy. I think this probably comes more to me being a little bit nutty. But I think this is within
It's your
healthcare and
episode, man. You can
otherwise.
be as crazy as you want.
My view is that I think that so many folks have really cool ideas that they always talk about doing, but it's really hard to kind of put one foot in front of the other and actually go up and end up doing it. What I've found with friends, family, kind of colleagues, etc., is that the first step is the hardest, but once you do it, you find out it's not that scary. So if you're working somewhere, if you're just coming out of school, if something seems like a cool thing you might want to spend time on, healthcare or otherwise, just go do it, see what happens, and it might work and it might not. Either way, I think generally you'll be better off from a life experience standpoint, giving it a go and seeing what happens.
Zach, it's been awesome having you on the show. And for those that have tuned in and spent time with us today, if you found this conversation particularly helpful for you, please, if you don't mind, share it on social, like it, engage with it. Let us know what stood out for you. So until the next one, Zach, look forward to our next conversation. And you're always welcome to come back on the show and share some of the new learnings. I know you kind of dropped a little bit of a hint about what's coming ahead in the future, but that may be another future episode, just as an FYI.
Thanks so much, Ben. Appreciate your time.
Cool, man. Bye bye.